Switching from mouth to nose breathing, these are the most typical questions that your clients will bring up, and maybe they're not sure if they can switch to breathing in and out through their nose. What would you say? So here's my explanations typically that I give to my own clients. What if my nose is stuffy? So people will say, well, my nose is stuffy because I'm allergic to animal dander, dust mites, pollen, etc. Well, can we still decongest the nose? And the answer to that is for children, they will continue to have a stuffy nose until they can reach 40 paces plus in their step score. So with a child coming in, of course, we want a child breathing in and out through the nose all the time, but also practicing their steps exercise, 6 repetitions 2 times daily. And I would always say to children, if they say to me 1 week later, my nose is still stuffy, I can't breathe through my nose, I will simply ask the kids, what's your step score? And explain to them that yes, you will continue to have nasal obstruction of the nose, you will feel uncomfortable trying to breathe through your nose, as long as your step score is less than 40 paces. Now, when it comes to adults, we don't use the step score as the main measurement, we use the control pause. So it's quite similar for adults. So an adult coming in with a stuffy nose, they will have their main symptoms until their control pause reaches about 20 seconds or so. So that's really, about, I suppose, a more objective measurement. And first, we will quantify as to whether the nose is stuffy due to rhinitis or is the nose stuffy due to deviated septum, which leads me on to the next slide. So a client comes in, they have a deviated septum, which is very common, and this is when the line that's dividing one side of the nose to the other, when it's crooked. And I think it affects about 60 to 70% of the population, depending on where you read. So if a client comes in with a deviated septum, you could say, could be a rugby player, could be a soccer player, or it could be somebody who's had trauma to their nose, or deviated septum may be possibly caused by a high palate. So if the roof of the mouth is high, it may cause the septum to become deviated. And I'm not sure first when they come into me, because I want to say, well, what relief can I bring their nose as a result of doing the exercises? So the first exercise that I will start off with is exercise number 1, the nose unblocking or decongest the nose exercise, and to practice that about 5 times. Does that help? In other words, is it easier for the person to breathe through their nose following the practice of the exercise? If it is, well, it tells us that the feeling of nasal congestion was not just due to the deviated septum, that the feeling of nasal congestion was also contributed to by nasal obstruction, a stuffy nose, or rhinitis. So when they do the nose unblocking exercise, it helps to alleviate rhinitis, making it easier to breathe through the nose. The rule of thumb is, if the person can breathe through their nose for 1 minute, they can do it for life. It's much better if you have them breathe through their nose for 3 minutes, because then it's a decent enough length of time to ascertain that the person can actually breathe through their nose. Now, if the person feels a little bit of air hunger, or they are feeling uncomfortable breathing through their nose when they do the exercises, that can be due to an underlying breathing pattern disorder. And the sensation of air hunger will go away as long as the person's control pause increases, or with children, their step score increases. So I would never worry about, a kind of mild sensation of air hunger when one switches from mouth to nose breathing. In actual fact, it's quite common, because we have to bear in mind, by the time a client comes to you, whether it's an adult or a child, they have been likely mouth breathing for some period of time. And if one is breathing through an open mouth for a period of time, they can develop a breathing pattern disorder. So when I first switched from mouth to nose breathing, I felt air hunger. I felt quite uncomfortable. So I used a nasal dilator during the day as well. So I used something like a strip going across the bridge of my nose to flare open the nostrils, and I used a nasal dilator during my sleep. So a nasal dilator can be helpful to ease the transition from mouth to nose breathing, but of course the sensation of air hunger will diminish over time, because as long as the person is breathing in and out through the nose. So the sensation of air hunger is likely due to an accumulation of carbon dioxide in the lungs and blood. And this happens because when the person switches from mouth to nose breathing, the nose imposes a resistance to breathing that's 2 to 3 times that of the mouth, Now, this is good. This is positive. This is during wakefulness, and that can allow for an accumulation of carbon dioxide. But by exposing the person to that higher carbon dioxide, it can help to improve their tolerance to carbon dioxide or reduce their chemosensitivity to carbon dioxide, which in turn is improving their underlying breathing pattern. So anyway, coming back to this slide here, so you've practiced the nose and blocking exercise 5 times. If that doesn't work, well then try the steps exercise 5 times. And the reason being is because the steps exercise is stronger. Now what I'm talking about here, I'm talking about exercise number 5B or exercise number 5C. And for the person to decongest the nose, you have to hold the breath until you build up a moderate to strong air hunger. Now, of course, not everybody is going to be suited to holding their breath to a moderate to strong air hunger. So you have to weigh in, is this exercise suitable for the person that I'm working with? Now, if the steps exercise is not suitable, well, continue doing maybe exercise number 5A. So holding the breath for between 5 and 10 paces and doing a number of repetitions, because that over time can also bring relief. The one thing about the human nose is that the more you use it, the better it works. So coming back to the steps exercise, your client, if they're suited to doing the steps exercise, they practice it for about 5 repetitions. The objective there is to hold their breath until they feel a relatively strong air hunger. So the longer that they can hold their breath for, this will build up carbon dioxide in the lungs and blood. And it's the buildup of carbon dioxide that generates a stress response, which causes the blood vessels in the nose, which have dilated, to shrink. So the blood vessels in the nose, which are dilated, they constrict in response to the stress response caused by the increase of carbon dioxide. Well, that's the theory. The exercise works, but maybe the precise mechanism is unknown, but at least that's one theory. And the rule of thumb here is if you can breathe through your nose for 3 minutes, you can do it for life. Now, the vast majority of people that I've worked with over the years, we have been able to get them to breathe through their nose. The exception is not necessarily deviated septum. The exception is more so people coming in with severe nasal polyps. So I always found that the most challenging. Because if the person has nasal polyps, sometimes to the point that no air can enter into their nose at all. So with that, they have to go to their doctor or ear, nose and throat doctor. So if, for example, you have a student who comes in or a client who comes in and there's no way on earth that they can breathe through their nose, well then you have to request for that person to go back to their medical doctor and either to get medication or some procedure to help open up the nose, because ultimately our goal is to establish nasal breathing. So whether we establish and decongest the nose by using the Buteyko method, or whether some medication is necessary or something else is necessary, it doesn't really matter, because our number one goal is to do whatever it takes to get the person breathing in and out through the nose. Now, another person might come into this often happens more so with children. So you're working with a child. You talk about the importance of breathing in and out through the nose. You spend a lot of time. The child understands it. You also have the child do the different breathing exercises. The child, of course, is wearing tape during the class. And you have been able to identify that this child is able to breathe through their nose in class because they've had their mouth closed for about 30 minutes or so. And, they felt comfortable breathing in and out through the nose. So off the child goes. They come back in a week later and the mouth is wide open again. You go through the nasal breathing, the importance of nose breathing. You go through the different breathing exercises. The child is wearing tape in the class. So the child is breathing through the nose. You even have the child jogging with their mouth closed. So nasal breathing, it has been established this child can do this. So off they go again. They come back in a week later and mouth is hanging open again. So you kind of get the gist of this. And I'm sure that you've come across clients who meet this criteria. We need to change the behavior, and it's really, really important. And with that, in addition to treating the nose, whether it's using the Buteyko method and having the child, emphasizing the importance of breathing in and out through the nose, it's also very important for them to wear a nasal breathing support during the day. And typically we use MyoTape. Now it is my own tape, but it was actually developed for children and partly to help change the behavior of mouth breathing. Parents can sound like a broken record. If, for example, every time they see their child with the mouth open and they are saying to their child, lips together, or ABC, always breathe correctly, or close your mouth, or anything to help encourage or remind the child to breathe through the nose. But after a while, the child can get fed up with the nagging of the parents. And, is there a different way to do it to help change the behavior? In other words, training the brain to associate the nose with breathing and not the mouth. So the child wears MyoTape, and the best thing for an instructor is to try it yourself. Stretch the tape about 30%, apply it surrounding the mouth, that it's not covering the mouth itself, and you will feel an elastic tension generated by the tape because it's elasticated cotton. So when it's stretched and it's applied around the mouth, there's a pull on the tape which is bringing the lips together. Now, if the child then is distracted, if they are watching television or doing homework or whatever they are doing during the day, and if they forget to breathe through their nose, and once they pop their mouth open, the tape will pull their lips together. So the tape is continuously reminding them, because of the elastic tension, to breathe in and out through the nose. So it can be a great tool to help change the behavior. We need to spend just as much time, especially with children. Now, some adults too, by the way, but especially with children, that we need to emphasize it's not just about opening up the nose, it's not just about improving the underlying breathing pattern, but it's also about changing the behavior. So you could have an adult coming in and they say, well, I tried breathing through my nose. I was sleeping last night and I was in total panic because I wasn't getting enough air. Now, there's a number of reasons why the person is feeling suffocated. So whether it's during sleep or whether it's during the day, it could be due to a smaller nasal airway. So anatomically, they may have a small nose so that the resistance to their breathing is too much. They may have a mechanical obstruction of the nose, deviated septum, which in turn is increasing resistance to breathing. They may have a stuffy nose, rhinitis. So this could be seasonal, which would be hay fever, or it could be chronic. So in other words, they have a stuffy nose for at least 1 hour a day, most days of the year. And that could be triggered by dust mites or animal dander, for example. Cats can be quite potent there. But they also may have a breathing pattern disorder, which is going to feed into the sensation of air hunger. So this is what I was talking about earlier on. The more you breathe through your nose, the sensation of air hunger diminishes. But in the interim, it can be very important to use something like a nasal dilator, because at least it alleviates the sensation of air hunger, and especially during sleep. And, there would be a role as well for a nasal dilator during sleep, because it helps to open up the airways, reducing the resistance to breathing in through the nose. And this in turn then can help to maintain a more open airway. So there is called the Starling resistor model, that if there's an obstruction upstream, it also can contribute to an obstruction or a narrowing of the airways downstream. So you don't necessarily want to have too much resistance of the nose, because that can impact sleep, and people with a stuffy nose typically don't sleep well. They are tired. Okay, so for children, this can often be a question. A child comes in, the child is having the mouth open. You are thinking to yourself, why is this child breathing through an open mouth? Is it because of a stuffy nose? Is it because of behavior? If it is because of a stuffy nose, is it because the front of the nose is stuffy? Maybe the child has rhinitis. Maybe the child is allergic to cats. Or is it the back of the nose? Could the lymphatic tissue at the back of the nose, where the back of the nose meets the throat, could that be enlarged? In other words, enlarged adenoids. So how do we help determine? Now, of course, we're not ear, nose and throat doctors. We can't diagnose whether it's the adenoids or not. All we can do is see, can we practice the breathing exercises and ensure if the child is able to breathe comfortably through the nose? We can do that. But if the child practices the breathing exercises, and if they still feel a lot of air hunger, and that's causing them to breathe through their mouth, well, then we have to suspect that maybe the problem is at the back of the nose. So coming back to this, child comes in class, child has the mouth open, I always start with the small breath hold exercises first, exercise number 6. Then I go on to exercise number 1. Now, of course, before I start working with the child, I ask them to wear paper tape across the mouth because I want the child breathing through the nose for the entire duration of the time that they are with me. Now, this is 10 minutes into the class. So ideally that they've got used to me. Their mom or dad is there. There may be a couple of other kids there. And I would have all of the children. I give them a roll of tape. The parents put the tape across the child's mouth and we start straight away doing the breathing exercises to help decongest the nose. So we start off with exercise number 6, which is small breath holds. That's just for technique. Then exercise number 1, nose and blocking exercise. Then exercise 5, which is the steps exercise. You could do 5A, 5B, and 5C. And then the question to ask is the child able to breathe through their nose during rest? Can they sit there with their mouth taped, breathing in and out through their nose for 3 minutes? And then the ultimate test is, can the child jog with their mouth closed for 1 to 3 minutes? Because if a child is able to jog with their mouth closed, well then it's a very good indicator that they have an ability to breathe in and out through their nose, that nasal breathing has been established. And of course, part of the reason of wearing the tape is to help change the behavior and to emphasize to the child the importance of breathing in and out through the nose, and also to demonstrate to the child, you can do this. There's no reason for you to have your mouth open. And not just during rest to breathe through your nose, but also during physical exercise. Another question that might come up is, I have heard of taping the mouth to ensure nasal breathing during sleep. Is it a good or bad idea? Now, I suppose my goal is to help ensure nasal breathing, that it becomes mainstream. It's something that I've been working and trying to work towards for everybody. I learned the importance of nose breathing myself back about 25 years ago, and it changed my life. It changed my sleep. It changed my concentration, my mood. So many aspects and many positive aspects from it. Now, we have to be realistic. Taping the mouth is not likely to become mainstream, but a nasal breathing support could become mainstream. So I don't think it's a good idea during sleep that a tape is used which covers the mouth. And I'll tell you my reasoning for it. Number 1, with children, it does present a risk. The risk is small, but the risk is there nonetheless. Now, we were lucky for many years. We were using paper tape. And with children, a piece of tape may be coming downwards, or we were using tape around the mouth, etc. But it's not without risk. For people with obstructive sleep apnea, especially if they have moderate to severe obstructive sleep apnea, it's not good to tape across the mouth. And the reason being is because people with moderate to severe obstructive sleep apnea, they need to be able to mouth puff. And if you stop that individual from mouth puffing, it can make their sleep apnea worse. So the objective is, even the words that we use as instructors, it might be better when you're working with your clients to shy away from the words mouth tape or taping the mouth, but nasal breathing support. It absolutely makes vital sense that once nasal breathing has been established during the day, for that individual also to breathe through their nose during sleep. But some people will need a nasal breathing support, and a safer option would be a tape that surrounds the mouth, that's bringing the lips together, such as MyoTape. In other words, not to cover the mouth. So there's some of my answers to my clients, and they will be the most common questions posed. So I hope this video has been helpful for you.